I think that we are still in the infancy of electronic medical records.
I think the first, several years that we've used it, it's all input. You're just putting in a bunch of data, collecting data, storing data. And now we're finding that you can really utilize that information to empower patients.
So that turns the EHR into an active part of the care delivery process as opposed to a passive record keeping or data gathering tool.
What that really does is starts to reach the real promise of what the whole concept was behind having an electronic health record. It wasn't just a repository of information. It really should be a living, breathing, working document.
And I think that's really where the real promise of electronic health records and health information technology lies. And now the frontiers of biomedical informatics research are turning to focus on how can we make better use of electronic health records. And that's the type of work that we're now engaged on, turning these electronic health records into active tools that can aid in health and wellness promotion.
Well, the SPHERE project started to reduce stroke risk for older women, and we brought together experts from the clinic and also biomedical informatics to design a tool for prevention.
So we had this request from Dr. Randy Foraker. She wanted to implement what you might think of as a health calculator, those apps that you can download to your phone where you input your data and it gives you a score. But present that score in a way that's meaningful for the patient.
So the fact that SPHERE actually pulls data into the application and presents that information immediately to the doctor so that the doctor can review that information with the patient is huge. One of the most important things with a clinic visit with a patient is efficiency. So anything that you can do to eliminate extra steps allows a better conversation with patients and doctors.
So now when you come to the visit, the doctor takes the link sends data from our EHR directly to the app.
So when we look at this SPHERE application, this top number is the overall cardiovascular health score. You can see this is in red, and it gives you a percentage score based on the data that was put into the system. So some of this data pulls in terms of blood sugar, cholesterol, blood pressure, that pulls into the application for you automatically. And you can see a lot of these areas are in the red as well. This is blood sugar, cholesterol, blood pressure, smoking status, weight, and height.
And so the patient and the provider both see this application. And each of the behaviors and factors that are the risk factors are shown in red for poor health and yellow for intermediate health and green for ideal health. And so that prompts discussion between the provider and the patient.
And as you modify that data, you can see that this red cardiovascular health score went from 7% to 21%, and you can already see this color starting to change to yellow with just a simple modification of that blood sugar. And it allows me to go through each of those with the patient and shows them a visual picture of what their cardiovascular health looks like and how they can improve that by modifying those variables. So it really opens up a platform of discussion basically regarding stroke prevention and cardiovascular risk.
I think that SPHERE has the potential to move the evolution of medical records forward. I think that we're just beginning to understand how to create tools like this in the context of the medical record in order to improve patient care.
You have to not just organize the data and present the data well, you have to present it in a way that other people understand it.
The fundamental challenge we face in healthcare is not so much the what in terms of what data we have, but rather the how. How do we use that data? And the thing that we specialize in biomedical informatics is the how. How do we take that data and deliver it to the right person in the right place in the right time, and frankly in the right format so that it's usable given the types of problems that they're trying to solve.